I got a question, a pretty practical question. I don't think this one should take that long. Um, and it's about, it asks what the difference is between doing like a wall squat and doing a kind of incremental exercise test on a bike, and differences, and talked about differences in kind of the ranges that you get. So the question was about inconsistency. So having different, for example, minimum SMO2 values that you reach during a wall squat versus a bike cycle test to maximum intensity. So both are maximum tests. So you're doing a wall squat for as long as you can, or you're cycling incrementally harder and harder for as long as you can. And they get different inconsistent values where you have both same minimum values. Sometimes you have two different values, and one's higher, the other one's lower for all these different variations. Now, and kind of the validity of those tests then, and then about trying to identify some kind of limitations in athletes. I'm sure a lot of people have heard about this limiter idea, where you have like utilization limited, so you can't extract and use oxygen, versus supply limited is where you have a problem supplying oxygen. I've also heard it used in different terms now, actually quite a bit. And it's like you have extractors and you have deliverers, which I think is like the flip side of that coin of the limiter idea, just flipped around. And so if the idea is to try to find out how well you extract and utilize oxygen in your muscle at the maximum capacity of that, you can only do that if you're also somehow assured that you've maximized your supply of oxygen. So if you don't maximize your cardiac outputs, your blood that's moving with oxygen to your muscles, you don't really know if you're maximizing extraction, because once you hit low values, you would say I've maximized extraction. But if you had a much larger supply, maybe you wouldn't get to such a low value, and all of a sudden it would look like you actually don't have enough extraction capacity. So I hope that makes sense. It's this supply and demand thing, right? That yours doesn't quantify it. It's just the relationship between the two. And so the problem with a wall squat is you likely don't get the same cardiac output as if you're doing a cycle test, for a multitude of reasons. And so if you don't maximize cardiac output and you say, well, I get lower values in my wall squat than I do in my cycle test, that would make sense. That is also what I would think happens in a lot of people, because you are just extracting a whole bunch at the local level, but you're not really supplying that much. So it's easier to push those values down lower. So you always have to consider the cardiac output that you're providing. Now, you might have some people that just get the same kind of value going on. That's just their extraction capacity. What's more interesting is like what happens if you have someone who doesn't get as low on a wall squat as they do cycling. I find that actually more interesting. I'm not sure if I have a good answer. So if you're doing a wall squat, you have a lower cardiac output, and you're assumingly have a high consistent muscular force that's also limiting blood flow, which would benefit even lower values of SMO2, and you have a high O2 demand by the contraction that you have going on. So you would expect these low values. And I would expect lower equal to the values you're getting during your cycling test. But if you don't have that happen, I haven't seen that actually very often. So the person sending the question says that they've seen this. I went through some data. I can't think of any examples that I have where I've actually seen this. But I've seen some funky with like weight training. I've seen some differences, a little different. So, but the isometric contraction might be a reason for that. Or like the type of contraction. So an eccentric and a concentric contraction don't have the same metabolic demand. And so if different contraction forms have different metabolic demands, you would expect that to be shown in your SMO2 values. So that might have something to do with that. That must have something to do with like the amount of training you do in your different muscle contraction forms. You might be able to optimize or increased efficiency in those contraction forms. I'm just spitballing here, but I think the main thing is that if you want to figure out some kind of, what is your VO2 limitation? So is it more this extraction arterial venous difference side, or is it more this cardiac output side? If generally accepted, cardiac output side is more likely to be your limitation, but there's arguments on both sides. It's probably case to case. It depends on the person, and depends on the sport, and depends on the activity. It probably varies within the same person too. I would argue, based on the literature, especially like sport-specific differences in VO2, things like that. So, but the point is, if you want to figure out which of those two things is more likely limiting your performance, or where you have more room for improvement, you're better off, I would argue, well, first of all, picking the test in the sport that you want to do, and picking a test that maximizes your cardiac output. So if you're measuring heart rate, your heart rate should go up a lot. So if you know your maximum heart rate's 170, 180, and you're doing wall squats and you're not getting higher than 140, it's probably not the best way to figure out if your extraction, so if your utilization or supply limited, or if you're a deliverer or an extractor. Yeah, that's it. Thank you very much. Bye.